Good evening. Welcome to Manual Therapy Ankle and Foot Lab Post Quiz. I hope you were able to learn today something about the ankle and the foot palpation and assessment and treatment techniques. We are going to discuss the quiz answers in this video. So let's get started. The first question is the structure which is 1 centimeter distal to the medial malleolus. So it's like an anatomical question. The correct answer to this is the substanticulum talus. Yes, in the middle part, 1 centimeter distal to the medial malleolus is your substanticulum talus. That was the correct answer, guys. Number 2 question, which test has poor sensitivity, poor specificity, or poor reliability? The correct answer to this is Homan's sign. The test, we need to see and check which test has good reliability, sensitivity and specificity. In this case, the correct answer which has the poor sensitivity and reliability is Homan's sign. The next question was, which of the following is not a site for palpation in Ottawa rules? Now, there were options, there were confusing options, and these are like tough questions. The correct answer is calcaneal tubercle. Yes. So this palpation is not included in Ottawa rules, which is like a clinical prediction rules to assess some diagnosis for ankle and foot. The next question, what is the diagnostic accuracy of Ottawa rules? Yes, guys, the Ottawa rules are highly diagnostic. So the correct answer is 98% or 0.98. It has a diagnostic accuracy of 0.98. All right. The next question, Cuboid Syndrome is a subluxation of the bone in which direction? Or medial, superior, inferior, which direction? The correct answer to this is plantar direction. This is the dorsum, this is the plantar. So the cuboid gets subluxed in the plantar direction. That's why we give like a dorsal manipulation when we are treating the cuboid syndrome. All right. Next question, which muscles entrap the Baxter nerve? Baxter nerve is one of the branches which sometimes gets misdiagnosed with the plantar fasciopathy. So Baxter nerve, the muscles that is involved is abductor hallucis longus and quadratus plantae. Yes, guys, these are the two muscles in the foot that gets involved when there's a compression of the Baxter nerve. Next question, it's a generalized question, that which is not a contraindication for manipulation techniques? Osteoporosis, yes, we are not discussing about absolute and relative contraindication over here, but osteoporosis is yes one of a relative contraindication for manipulations. Septic arthritis, yes. Malignancy, yes. The correct answer is pain and muscle spasm is not a contraindication for manipulation. There have been researches that shows that mobilization and manipulation, when done under these pain and muscle spasm conditions, they can actually help to treat them, but you have to do it carefully. All right. The next question is, what is the best diagnostic test for distal tarsal tunnel? The correct answer is option 1, clinical reasoning. Now, this was a tricky question, guys. You need to actually do a proper clinical reasoning in order to diagnose these nerve entrapments or distal tarsal tunnel syndromes. The next question was, what is the position of ankle for manipulation of talocrural joint? Talocrural joint is one of the easiest manipulation in the ankle, but you have to see which position you are keeping the talocrural of the foot. So the correct answer is you dorsiflex and evert it a little bit, eversion. So dorsiflex and eversion and long axis traction, feel the slack and then give a manipulation. So the correct answer is second option, dorsiflexion and eversion. Next question, the last question, what is the direction of force for lateral cuneiform manipulation? Now there are 3 cuneiform bones, if you guys remember in the anatomy, there is medial, middle or intermediate or lateral. So when we manipulate the lateral cuneiform, the direction has to be in the opposite direction, and the correct answer is the contralateral or the opposite knee. We explained you in the demonstration of the techniques that when you are doing the medial cuneiform, it goes on the ipsilateral hip. The intermediate or the middle cuneiform goes on the contralateral hip, and the lateral cuneiform goes on the contralateral knee. So you are manipulating in that direction to help with the lateral cuneiform. I hope you were able to score the passing marks, which is 7 out of 10 or more, to achieve your certificate, to get your certificate. I hope you learn. If you have any questions or concerns, you please email us at isorehab@gmail.com. We will see you soon in our next webinar on the ankle, on the elbow, hand and wrist. Keep learning. Thank you so much.